This is an Andy's Randomness special report. Reporting now, Andy Pollock.
Oh. Okay, are we on? Think we're good? Okay. Good morning, everyone. Andy Pollock coming to you live from the Random Studio in Fresh Meadows, New York. We are waiting for the daily COVID-19 update from New York Governor Andrew Cuomo. Obviously, you have been hearing in the past day that we are going to be hitting the apex of our COVID-19 cases. We've been hearing that Nassau and Suffolk County are going to see an influx, or probably have seen the influx of hospital patients already out there. We're getting numerous reports in the past 24 hours that there are almost no ICUs available at Long Island Jewish. That is very alarming. We're also receiving reports that they're also almost done with their ventilator supply in New Hyde Park. We're getting the same reports out in Manhasset. We're getting the same reports in Syosset. Pretty much the Northwell system is reporting system-wide that they are running low on supplies. And this is where you can help New York State right now. This also applies to Winthrop Hospital in Mineola, Nassau University, Mount Sinai. Any hospital you can think of that needs supplies, Jamaica or Elmhurst, anything. You can call the New York State donation line at 212-803-3100 or email COVID-19 supplies at esd.ny.gov. Now, I want to mention for my Nassau County viewers, if you need updates from Nassau County, you can text COVID-19 NC to 888-777. Once again, that is 888-777. Now, thankfully, I did come on the air as soon as I knew the governor was supposed to be speaking at 11 o'clock this morning. So, you're only seeing their image on the screen right now. Yes, I'm correct. So, he is speaking, but he's supposed to speak now. And he is running late, fashionably late. So I'm just going to get the stream out there for everybody so that way you all know that he is speaking shortly. So we are waiting for him in just a second. So, I want to mention that yesterday the president was suggesting that the NFL could start in September. And I think if we flatten this curve, there's a good chance that I could be seeing Lamar Jackson back on the field in September, of course. Oh, by the way, before I ramble on about Trump, what he said yesterday, if you're in New York City, you want updates, you can text COVID to 692-692. And I will mention that yesterday they sent me it was yesterday. Okay. If you need 911, anywhere in New York State, I found this out, this implies in New York State, please only dial 911 if it's life-threatening. Meaning if you hear a shooting, dial 911. Do not bother 911 about large crowds, because they do not need to be responding to that right now. So, sorry to say it, but that's reality. My throat's a little bit dry, but I'm hoping the governor is going to be speaking shortly. So actually, you know what I'm going to do? I'm going to put the stream on so that way when he does come out, Mr. Cuomo, you can see him as soon as he comes. So I'll put it on right now. So I'm going to put the feed on. Here we go. So we're now going to go to the feed in Albany. And you will all watch New York Governor Andrew Cuomo when he steps to the podium.
Good morning. Happy Sunday. For those of you who celebrate, happy Palm Sunday. Happy Passover week for those who celebrate Passover. Thanks for taking the time to be with us today. We want to give you an update as to where we are. The number of cases increase, which is nothing new. It's happened every day since we've started this. It's been a long month. Something a little bit different than the data today. We're not really 100% sure yet what the significance is as we're feeling our way through this. Number of people tested, 18,000. Positive cases are up 8,000, total of 122,000 cases. Number of patients discharged, total discharged up is 12,000, 1,700 discharged in one day. Number of deaths is up. That's the bad news. It's 44,159, and we pray for each and every one of them and their families, and that is up, and that is the worst news. But the number of deaths over the past few days has been dropping for the first time. What is the significance of that? It's too early to tell. This is the impact by state. But as I said, the interesting blip maybe in the data, or hopeful beginning of a shift in the data and the number of cases. Total number of new hospitalizations is 574, which is obviously much lower than previous numbers. That's partially a function of more people being discharged. But you see ICU admissions are also down. The daily intubations down slightly from where it was. Again, you can't do this day to day. You have to look at 3 or 4 days to see a pattern. Discharge rate is way up, and that's great news. And the statewide balance of cases has been relatively stable for the past few days. There is a shift to Long Island. Upstate New York is basically flat, and as Long Island grows, the percentage of cases in New York City has reduced. This is when, for those people who look at the data, you have all these projection models, and what's been infuriating to me is the models are so different that it's very hard to plan when these models shift all the time. But there's also a difference of opinion on what happens at the apex, right? All the models say you go up until you go down. Thank you very much. Then there's a difference of, is the apex a point or is the apex a plateau? In other words, do you go up, hit the high, and then immediately drop, or do you go up and then there's a plateau where the number of cases stays high for a period of time and then drops? There's a difference of opinion. So you have to think of that when you think about what you're seeing in the numbers, because you could argue that you're seeing a slight plateauing in the data, which obviously would be good news because it means you plateau for a period of time and then you start to come down. And we're all feeling our way through this, and we have the best minds in the country, literally on the globe, advising us, because New York is the first. I also think it'll be very helpful for the other states that follow. I was just talking to Dr. Zucker about codifying everything we're learning, because when the next states start to go through this, we hope that they can benefit from what we're going through. But we're looking at this seriously now, because by the data, we could be either very near the apex, or the apex could be a plateau, and we could be on that plateau right now. We won't know until you see the next few days. Does it go up? Does it go down? But that's what the statisticians will tell you today. As we've said before, the coronavirus is truly vicious and effective at what the virus does. It's an effective killer. People who are very vulnerable must stay isolated and protected. I mean, that was the point from day one. That was the point with Matilda's Law, my mother. You have to isolate and protect those people. If a very vulnerable person gets infected with this virus, the probability of a quote-unquote cure is very low. And that's what this has really been about from day one. That small percentage of the population that's very vulnerable. Major effort that has impacted everyone to save the lives of those people who are in the very vulnerable population. If you're not in a part of that vulnerable population, then you will get sick. 20% require hospitalization, but the hospital system is very effective and it makes a real difference. And that's why the highest number of people ever now being discharged, right? So you're just seeing the evolution of this whole story. You're seeing the narrative unfold, right? We're all watching a movie. We're waiting to see what the next scene is. And as the movie unfolds, you start to understand the story better and better. Rush of infection rate, rush of people into the hospital system. Hospital system capacity explodes. More people are in, but more people are coming out. 75% of those people who have now gone into the hospital system are coming out of the hospital system. It also helps with the capacity of the hospital system because obviously the more people who are coming out, it makes it easier to handle the large influx that's coming in. Having said all of that, the operational challenge for the healthcare system is impossible because the system is over capacity all across the board. It's just over capacity. So what we're basically saying to a system is you have to manage with the same resources that you have, same staff, an overcapacity situation. And that is putting a tremendous amount of stress on the healthcare system. You're asking a system to do more than it has ever done before, more than it was designed to do with less. I understand that, and I get that. And day in and day out, the commissioner and everyone at this table deals with the healthcare system. I understand what they're dealing with. I understand they're being asked to do the impossible. And they are being asked to do the impossible. But life is options, and we don't have any other options. So you get to a situation and you do what you have to do in that situation. And that's where we are. The only operational plan that can work, right? Because you know the system doesn't have the capacity, doesn't have the supplies, doesn't have the staff. So how do you handle this surge over capacity? We have to surge and flex, which means you have to deal with, if you're an individual hospital or hospital network, yes, you're going to be over capacity. And the only way we can make this work is if we flex the system so that we take all hospitals, all hospital networks, some hospitals are in networks, and we work together as one system, which has never been done, right? We have public hospitals, we have private hospitals, we have Long Island hospitals, we have New York City hospitals. In totality, it's the healthcare system. The state manages, regulates the healthcare system, but they're all individual hospitals or individual networks, and they are accustomed to just doing business and managing their own affairs. That doesn't work. We have to balance the patient load among all of these hospitals. So if one hospital starts to get high or has a projected high intake, we have to shift that patient load to other hospitals. That means some patients who show up at their neighborhood hospital may be asked, can we transport you to another hospital, which is not in your neighborhood, but actually has more capacity. So we have to adjust that patient load among all of the hospitals. which is a daily exercise, and it's very, very difficult. We're running short on supplies all across the board. Some hospitals happen to have a greater supply of one thing or another. One hospital has a greater supply of masks, one hospital has a greater supply of gowns, and when we're talking about supply, hospitals are accustomed to dealing with 60-day supply, 90-day supply. We're talking about 2 or 3 or 4 day supply, which makes the entire hospital system uncomfortable, which I also understand, because we're literally going day to day with our supplies, with our staff, etc., which is counterintuitive and counter-operational for the entire healthcare system. And I understand that also. The big operational shift will be that Javits coming online. If we get that up and running efficiently, that's 2,500 beds for people who test positive with the COVID virus. That is a major shift for the systems. And at a time when we desperately need a relief valve for the system, Javits could do that. So we're working very hard to get that up and running. But that rolling deployment, that flexibility, there is no other way to do that, to do this on the state level. You know, I can't say to a hospital, I will send you all the supplies you need. I will send you all the ventilators you need. We don't have them. We don't have them. It's not an exercise. It's not a drill. It's just a statement of reality. You're going to have to shift and deploy resources to different locations based on the need of that location. I think that's going to be true for the country. The federal government, everyone says the federal stockpile, federal stockpile. There's not enough in the federal stockpile to take care of New York and Illinois and Texas and Florida and California. It's not an option. The only option I see is there's a national deployment. Everybody says this is wartime. It is a war, and the virus is the enemy, where New York, help New York today. Thank you, State of Oregon. We're dealing with this curve today in this intensity, and then nationally, we shift the resources to the next place that is most impacted, right? Just what we're doing in New York City, in New York State on a microcosm, we shift resources from the Bronx to Brooklyn to Queens to Nassau, shift national resources and state resources from New York to Florida to Illinois, whatever is next on the curve. We're going to do that in any event. We get through this. People have been so beautiful to us, and it is the New York way. We're going to codify everything we've learned, and we get past this curve. Whatever part of the country goes next, we will be there with equipment and personnel and however we can help. Federal government is also deploying approximately 1,000 personnel to New York. That's doctors, that's nurses, it's respiratory technicians. The immediate priority is to deploy those people to help the New York City public hospitals. The New York City public hospital system, H&H, was a system that was under stress to begin with, before any of this. So obviously, you add more stress to institutions that were under stress. It only makes the situation more difficult. So we're going to deploy all the federal personnel who are coming in today, 325, to the New York City public hospital system. I talk to the hospital administrators on a daily basis. We get them on a conference call and we do this shifting of supplies and balancing of patient load. I know that I'm asking them to do really difficult things. I get it. I don't enjoy being in this situation. I don't enjoy putting them in this position. I know their staff is all overburdened, but all I can say is thank you to the administration of this healthcare system, and most importantly, thank you to the frontline workers. I mean, these people, they are true heroes in the truest sense of the word, what they do day in and day out under very difficult circumstances. And we thank them all. On a different, somewhat lighter note, there's an accompanying affliction to the coronavirus that we talked about early on. It is cabin fever. It is a real situation, not medically diagnosed. I asked Dr. Zucker, there's no medical definition for cabin fever, but I believe it exists. It's a feeling of isolation. It's often accompanied by radical mood swings, resentment of people around you, varying degrees, for no reason whatsoever, just an upwelling of resentment, especially towards people who are in apparent positions of authority in the situation, which I've noticed. Irrational outbursts can come in at any time without any warning, just an irrational outburst, frustration, anger, with no rational basis. Cabin fever in many ways also threatens the essence of our Constitution, which is premised on people ensuring domestic tranquility, and it can be disruptive to tranquility. I can attest to that. It's a real thing. Think about it. It's only been 1 month, but it's been a long month. Positive interventions for cabin fever. I'm going to take up running again. I used to run back normal days before this job, but I'm going to start running again. My daughter Cara, we're going to run as a family. We're going to go out there. Cara's got a head start. She's out there doing 5 miles every day. She thinks she can beat me. Give me a couple of weeks. I'm going to be right there. Fast like lightning. We're going to do it. We're going to make the dog come. The dog is also experiencing cabin fever. He's a little disrupted. The order of the pack has changed. Different people. He doesn't know where he fits. He has anxiety. He's going to come out. He's going to run. Think of ways to deal with it. I don't have any great answer. But a little perspective on the whole situation is also important. I challenged my daughters. This is terrible. This is terrible. This is terrible. This is terrible. I've been saying it's terrible. It's been terrible for society, the economy, personally. But, let's look back at history, right? Generations have gone through terrible times. So my challenge to them is, you find me a generation that has had a better overall situation than where we are right now. Go back, World War I, World War II, Vietnam, 1918 flu pandemic. You find me a generation that hasn't had a challenge to deal with. And we're going to have that discussion. And also keep in mind on perspective, this is going to be over. You see on this story developing, you can start to see how the story ends, right? They will have a vaccine. Will it be 12 months or 14 months or 18 months? There are a number of treatments that are being expedited and are being tested right now. Dr. Zucker in New York is working expeditiously and cooperatively with the FDA to try all new different treatments. The convalescent plasma receptor antibody treatment we're working on, the hydroxychloroquine we're working on aggressively. So we're trying all these new treatments. Some of them show real promise, but you can see that where the story ends. I think, and this is opinion, not fact, I think you see the return to normalcy when we have an approved rapid testing program that can be brought to scale. We're now testing rapid testing programs. But when you get to the point where you can do rapid testing of scale and people can start to go back to work because they know they're negative, we continue to protect the vulnerable population, which is where this was about, but we liberate, as my daughters would say, they're seeking liberation. We liberate people who can go back to work because we know that they're not in a vulnerable category and they're negative. And I think that is, it's under development now, the rapid testing, and we're part of it. But that is going to be the answer, I believe. And we get through it because we are New York State tough. Thank you.
In terms of the data that you're saying, this 594, which is a slight dip from yesterday, how many straight days would you say, or statisticians say?
All right, so once again, that was Mr. New Yorkers Love Me, Andrew Mark Cuomo giving his daily coronavirus briefing. And there's actually some good news. Can't believe I'm actually saying actual good news. This is the best I've heard something positive in about this virus recently. So, I tweeted this picture out earlier, and that is yesterday. We actually saw hospitalization go down. Now, does this mean that we are flattening the curve? Only time will tell. But this gives us hope, folks, here in New York State. This actually gives us hope. Only 500 something people went into a hospital yesterday. So you're seeing it go down. There was a part of the curve where it flattened back on March 27th. You're seeing, I don't know, maybe around, but this is where the curve starts to flatten, right around here, right around Friday. Then you go to Saturday, which is yesterday. So let's see, maybe we are flattening this curve. Maybe we are starting to actually flatten this curve. Now, I don't know what that will mean, but I'm going to play you a clip that disturbed me yesterday, because the governor just said 18-month vaccine. Hang on. It's WFAN. Oh, this is interesting. WFAN will be re-airing classic games throughout the weekend. Okay, I just want to see if I can rewind back to last night, because Steve Summers was on, and a caller from Pittsburgh called in and didn't sound so good. I want to pause this for a second. 9 a.m.
So make sure you're locked in.
That doesn't help me. Let's see. Here we go. I think it was somewhere around here.
On WFA.
And
I don't know. I had trouble falling asleep last night because, I don't know, last night, you know, I just kept thinking about my past life before Corona.
I never needed it.
That's not
calling
it.
from Orange, New
Nope.
Undropped, okay?
Nope.
That's my thoughts to my family in Westchester, all my friends, and everybody in New York City. I'm
Sure.
just, Steve,
I think
never
this
thought
is it.
this
Let's
would come
listen.
to this. All the years we're talking, 34 years. Did you ever think you'd see anything like this in your life?
Never. Of course, nobody has.
It's unbelievable. But I wanted to talk about just a flashback for a moment, just a flashback to how he's calling 94 when Mateau scored the goal, and how he was New York.
Right.
So I was calling,
And I'm glad,
brother.
I'm glad you did, Robbie, and
Thanks,
same
buddy.
to you. Yeah, be well, stay safe,
too.
stay healthy,
Thanks.
and thank you for all the years that you've been a part of the radio station. Let's go to Craig, and he is calling from Pittsburgh. Craig.
Yeah, hi. Good evening.
Hey, good evening to you. What's happening?
Well, we're about hunkered down here, my friend Steve. I had played a game called Be a Manager when I was growing up. You're a couple years older than me, but, ours was, I think, 1967.
Okay.
Wonderful game. Wonderful baseball game. And before I get too much further, Steve, I wanted to, it's horrible what's going on in New York City, and we pray for you guys out there.
Well,
we don't have it so bad.
Well,
other places frankly don't have it so bad. But you guys really have it bad. We do. We pray for you. You had
Well-
mentioned something, and my intention is not to be contentious here, but you had mentioned something that, we won't have the playoffs, we won't have NBA, we won't have sports until we get a vaccine. Just exactly when is that?
Well, I'm not. I wish I knew. I wish I could say
18
tomorrow.
months. The soonest is 18 months. Do you think anybody can not work for 18 months?
Well, let's hope you get back to work.
You can't.
Yeah,
You
well,
can't
here's
have
the
it,
thing.
my friend.
Well, would you rather have a game at the expense of somebody dying? You tell me.
It's not an either-or situation. Would you rather... You're going to cause people to die by having nobody work. I'm not just saying sports.
It's, believe me...
18 months, Steve. 18 months. And
Let
they're
me see.
talking about...
Well, hold on a second.
They're not going back.
Hold on a second. Hold on a second. Shut up. Shut up and get off. I mean, you're crazy. We all want to get back to work, those who are out of work. There's no question about that. It's awful. There are families at home. There are kids home from school. And of course, the stimulus checks have yet to arrive. I can say this for certain, that those stimulus checks will arrive before the vaccine. Nobody has said that once we get a vaccine, before it's distributed where we can all get the vaccine, that it's going to take 18 months. I don't know, and I'm paying attention to what I'm hearing, and I've never heard 18 months. Now, it could take 18 months. I don't know, and I hope it doesn't. But the bottom line is, the sooner we get a vaccine, the sooner you'll be able to go back to work.
All right, so once again, that was WFAN's Steve Summers. And I will mention, last night, this show, believe it or not, was actually simulcasted on CBS Sports Radio. So this guy in Pittsburgh made a fool out of himself. Now he's made a fool out of himself on my YouTube channel. I mean, 18 months. Cuomo just said that a vaccine could take 18 months. Could. It's not guaranteed that October of next year, which is 2021, we're going to have a vaccine. We don't know that. We don't know anything. We just have to take this day by day. Today, I'm just assuming maybe we are flattening the curve. Maybe. Let's just hope it does flatten. We have 2 more weeks of this at least. Anything goes. Again, we are only on day 3 of the 2 weeks they were forecasting from. Actually, no, day 2, excuse me, because they said anywhere from April 4th to the 18th. That's 2 weeks. 2 weeks. Then what happens in May? We just don't know. We just do not know. No comments. So, let's see if I can read some of these articles. So there is a video, it looks like. I might want to play this. Let's see if I can play this video.
What do you think the percent chance is that we will not have college football being played this fall?
I'd say 90%. I mean, guys, I want it to happen, but I mean, look at everything. Yeah. How many stay-at-home states are we at now? And the most frustrating thing
Well, I wouldn't go with that source. I'd just rather would go with ESPN. If I could find something on YouTube. The NBA is thinking of canceling the season, which if they do, then you know what? Fine. It doesn't matter. It really doesn't matter at this point. I spelled ESPN wrong. I made an epic fail. I'm going to see what I can find. And see if Adam Schefter was on ESPN yesterday. Because he was the one that broke the news about Trump claiming that the NFL may come back, which I'd hope so. Let's see. I don't see any videos. Don't see anything here. Here we go. This will have to do if it'll even play.
Commissioners of the major sports leagues in our country, that is a sign of optimism, Trump said during a conference call with the commissioners of the major sports leagues in our country. That is a sign of optimism. He expects the NFL season should start on time as scheduled, eventually with fans in attendance, though it remains unclear if public health officials and experts find that to be realistic. In addition to his timeline on the NFL, on this conference call, the NBA Commissioner Adam Silver told people his league was the first to shut down and that he would love to lead the way in starting the economy once there was a, quote, all clear from public health officials. The president suggested leagues work together to lobby for tax credits as well. Here is the president speaking about the conference call at his now daily briefing.
I just spoke with the commissioners, leaders of, I would say, virtually all of the sports leagues. They want to get back. They got to get back. They can't do this. Their sports weren't designed for it. The whole concept of our nation wasn't designed for it. We're going to have to get back. We want to get back soon, very soon.
With all that said, if there was ever a case of political football, it is here, and so is the NFL's best insider, Adam Schefter. What are people around the league saying in response that you've heard to President Trump's comments on Saturday?
Well, Zubin, everybody wants football back. We all do, and we hope President Trump is right in his assessment that he wants the season to open on time in September. But the truth of the matter is Dr. Alan Sills, the NFL's chief medical officer, addressed it this week, as did Dr. Tom Mayer, the NFLPA's medical director, and nobody knows right now. There has to be a system of testing in place before we're going back into stadiums. Maybe they could develop a vaccine at some point down the line, which doesn't sound like it's going to at some point this season. And as much as everybody wants football to be back, it's hard to imagine it being back in front of huge crowds. You heard the California governor, Gavin Newsom, come out today and say he doesn't anticipate football games being played in the state of California this season. Quite a statement. Now, maybe they take those games for the Rams and the Chargers and the 49ers, and maybe they're playing them in Nevada or Arizona or somewhere nearby. The fact of the matter is, Zubin, this story changes on a day-to-day, week-to-week basis, often dramatically. We don't know where it's going. It's not going in a good direction right now. And it's too early to say that there will or won't be football this season. All we know is that this country has some major issues to address before we can even get to the issue of whether or not there'll be a football season.
No question. Like you said last week with Scott Van Pelt, priorities have to come into play here. The NFL schedule is scheduled to be released no later than May 9th. Whether there's a season that comes to fruition remains, like many things, unknown. Adam, thank you.
Thank you, Zubin.
Well, we've been shining these.
Okay, folks, so there you have it. Is there a possibility we could have the NFL come back? I'm praying we do. Just like how I'm praying we even get college back, let alone the regular NFL. Because then what am I supposed to watch on Saturday afternoon? I'm supposed to look forward to college and then the NFL on Sunday. I'm keeping faith. I really am keeping faith that we are going to have football. Really am keeping faith. Really am. Trust me. So, with that, we're going to wrap up the stream. Thank you all very much for watching. This has been an Andy's Randomness special report.
This has been an Andy's Randomness special report.